My name is Kendra Roundtree. I am a 2007 graduate of Mercer University School of Pharmacy, and I currently am a cardiometabolic sales specialist with Novo Nordisk. I am on the commercial sales side of things. So in my day-to-day, I am responsible for discussing obesity therapy management and protocols with providers. Basically from here in the Atlanta area all the way up through Roswell. In this role, I am responsible for delivering to my providers the clinical benefits and and providing them with the resources that they need to best take care of their patients dealing with or living with overweight or obesity. And then also, a big part of my job, yes, it's the science part behind it. Yes, it's the sales part. But the biggest part I always like to emphasize is it's the relationship building, which is why when people are like, you're a pharmacist and you stepped over into sales, I have a passion for healing and for patient health. And if part of that is developing those relationships with providers where it's a trusted relationship and it's an advisor type relationship, then hey, it all comes together and definitely adds to the joys of my day for sure. I have known I wanted to be a pharmacist since the age of 7. People are like, how do you know at 7 you want to be a pharmacist? It's simple. We had a little store, grocery store in my hometown of Warner Robins, Georgia. It was called Family Mart. And at Family Mart, there were 2 pharmacists back there in the pharmacy. It was Dennis and Mr. Charles. And my thing was, I go to the doctor pokes me, gives me shots and all this other stuff. I go see Mr. Dennis and Mr. Charles. I get the pink medicine and I feel better. And just even at an early age, having that early association with, pharmacists. At that point, I didn't realize it, but pharmacists playing such a key, critical role in patient health and improving the health and lives of patients and communities overall. So that first sparked my interest in pharmacy, And as I continued through school, I was very big and took a very strong liking to math and science-based coursework. And, while I was in high school, I sought out opportunities like, hey, if this is what I think I want to do, how about I volunteer, see if there are volunteer opportunities. So I began volunteering and then later working at a hospital in my hometown, and the rest is history. So even starting before Mercer's pharmacy school, Mercer undergrad, it was great because, being a part of a community and a culture that not only cared about your academic ability and your scholastic ability, but it was an environment, the Bear family of pretty much like we're one. We all come from different areas, different backgrounds, but we are one. We came in together, we're gonna leave together. So I loved that culture. Also Mercer's strong academic record that just follows the university overall, be it pharmacy, be it medicine, be it law, engineering, liberal arts. So that was very big for me. I wanted to go to a university that when I stepped out on day one, when employers saw that on my resume, that there was already a level of credibility because they knew Mercer had me prepared for the job in which I was seeking. Pharmacy is a test of your endurance and your resilience. And, just know that coming into it, that it is, there's a level of dedication because, for the longest, pharmacists had that role as most trusted profession, and there's a reason behind it. Patients come to us and through us to seek advice on things that are so critical as far as their health and their medications. So be ready for it. Be ready for it. And then the last thing I would say is just be excited about being a part of a profession that we always sometimes think of it as like 1 or 2 opportunities. Well, really, since coming out of pharmacy school in 2007, I've seen a myriad of options and critical areas where pharmacists and the level of expertise that pharmacists bring to the table where it's essential and it's needed.